योगः कर्मसु कौशलम्.
Namaskar friend. Today with us Dr. Kamyani Mathur. She is working as a professor and head psychology department. She is also director of philosophy, psychology and education department. She has 23 years teaching experience. She is awarded the Gyan Adhyapak Award by Education Minister of Gujarat State. She is presented more than 6 research papers internationally, and she is attended the more than 39 conference and more than 40 research paper published by her. She is member of American Psychology Association USA. She is presently member of International Association of Applied Psychology France, and 12 PhD student and 26 MPhil student awarded by under his guidance. Today she is talk on stress management. Friend, I welcome you, Dr. Kamyani Madam. Please deliver her session, Dr. Kamyani Madam.
Hello everybody. आप सबको मेरा नमस्कार. I'm Dr. Kamyani Mathur, Professor and Head, Department of Psychology, Gujarat University. I'm also the Director of the School of Psychology, Philosophy and Education, Gujarat University. At the outset, I'm extremely thankful to our HRD Center, Gujarat University, for inviting me for this series of lectures in the psychology. Today we are going to talk about a very important topic which is very relevant in the COVID times, and that is the stress and its management. There are many ways in which stress is understood and how it can be managed. And since I'm a clinical psychologist by profession, I would like to give it a psychological perspective only. So let us now understand, before we go to the actual definitions and understand it, I just brought some images for you. Look at this image. This man is almost ready to tear his hair. Second image, expressions, your eyes, facial expressions, how you're dealing with stress, a woman in the workplace, maybe in managing director or CEO of a big company, too many tasks to be handled, is getting very, very stressed. So what is stress? It is a disease of the 21st century. Number of cases are growing alarmingly, 1,000 times more than they were 10 years ago. And this perhaps we will say even after 10 years. So stress is defined as a perturbation of the body's homeostasis. Stress is any stimulus from the environment which demands extra adjustment, effort, or survival effort from the body. So whenever you are under stress, you need to make some extra adjustment with yourself, and then only you are able to cope up with it. Anxiety, tension, sleeplessness, nervousness, muscle cramps, all these can be results of stress. Look at this lady. She's working. I really like this image, and I thought I would share with you. I'm stressed. How about you? So according to Neufeld, stress is a byproduct of the poor and inadequate coping. The Canadian physiologist Hans Selye says that stress is divided into eustress and distress. Eustress is positive stress. For example, in a wedding, if you're getting married, for example, then wedding by itself is a very happy moment for the individual and the family. So stress is there, a lot of work is there, it's a lot of hard work, too much to be done, but you're very happy about it. That's why it's a eustress, positive stress. Distress, which is negative stress, for example, death of a loved one. Like in today's times, we are all distressed. We are learning to come out of the COVID-19. And we are learning to cope with the different problems which are coming on an everyday basis. So what are the sources of stress or the categories of stress? Frustrations, conflicts, and pressures. Frustrations, which we all understand, I'm not saying anything new, that when a person's strivings are thwarted by the various obstacles which are coming when he's moving towards a goal, or very simple, that there is just no goal. A lot of people just get up in the morning and sleep in the night and that's it, and there's no goal in their life. So frustrations are very common when you're facing prejudice, when you're facing casteism, when you're facing gender discrimination, or your dear one does. Conflicts. Conflicts, as you very well understand, are faced when you have two or more choices. You have two or more needs or motives, but you have to select one. You can't select both. For example, a woman loves her job. She's professionally very well qualified for it and doing a very good job. But she has to give it up for her family because maybe her children are young and there's nobody to manage them. So who is going to look after her children if she's on the job? Pressures. To achieve specific goals or behave in a particular way force us to speed up, intensify our efforts, and change our methods of working. Let's take the example of a student who wants to appear for an examination. So maybe he scored 50-60% last time. Now he's been asked to score more because maybe he has to go in the medical line, or maybe he has to go for engineering or something like that. So he has to speed up and he has to intensify his efforts. He has to change his method of learning, etc. And then only he'll be able to pass the exams very successfully. Which are the factors which are predisposing to stress? What is the nature of the stressor? What causes the stress? Which are these events? So what is the importance of the problem in front of you which is stressing you? How important it is? It's a matter of your promotion. It's a matter of your finances. How important is the problem? The more important the event, the more important the problem, the more the stress. Duration means time period. How long this has been going on. Then the cumulative effect of that. For example, you've been suffering a very bad marriage. So one day there'll be a blast. That is cumulative effect. When does it appear in your life when you just don't need it? Is it natural, under natural circumstances? Or it is man-made or artificial in nature? That is going to depend on how stressed you're going to be. How prominent was it in your life? You've been working for it for years and years and you want it so badly. But now, you're unable to reach out to it. So it's going to cause you a lot of stress. Is it within your control or not? Crises in our life sometimes just break us down. We don't know what to do. Problems from all the sides. There's an accident. Somebody is lying on the deathbed. Suddenly you come to know that you've got cancer. These are crises. You fail in the most important exam of your life. Life changes. Means from the period that you were a child, to a teenage, to an adult, to now. These changes in life periods also bring about lots of stressors. The person's perception, that is your perception, how you look at the problem will cause you stress. Like today in the COVID-19, everybody says, do this, do that, and you should not catch the infection. All right, you've got to be careful. But constantly, if you live under the fear and anxiety that I'll get it, that's your perception. You can just do the prevention. You can do your best. Otherwise, it's going to cause you a lot of stress. So what is not going to happen will happen. Individual stress tolerance is a very important part over here. We all are different individuals. We all are different personalities. And our stress tolerances are very different. That I mean to say our thresholds. Today morning only I saw a young girl. She was to be given an injection and she was to be tested. Her blood test was to be done. And before the doctor even took the injection in the hand, she was screaming and shouting. I can't remember how many injections I've taken in my life or how many times I've given my blood. What is necessary is to be done. Yes, it stresses you. I'm not saying it doesn't stress me or that girl. But each one of us, our stress tolerances are different. And that's how we experience stress. Lack of external resources and social support. Just imagine if you were in America and your parents told you, wherever you are, my child, we are with you. Just to call and we'll be there. You need the money? You need emotional support? What do you want to do? You want to leave the course and come back and you're not fine with it? Come back. We are with you. So this is support. It will definitely reduce your stress. So how does one cope with stress? Psychology defines the coping of stress in two ways. There are a set of people who are task-oriented in their behavior. Task-oriented means that you want to make changes in your life. The surroundings depend on the situation. You want to show more affection towards your spouse. You want to lower your aspirations. So task-oriented people will change their methods of working because they have to reach the goal. So if you're task-oriented, you will try to make better adjustments, make sure that you are also happy and everybody else is also happy around you. So be it the office, be it at home, be it with your family, be it with your children, be it with your friends. Defense-oriented people are constantly defending themselves, always blaming other people. Feelings of adequacy are seriously threatened by the stressor. They want to actually protect their ego. When they're defensive, they want to protect the ego. If you remember Freud in psychoanalysis, Freud is talking about the ego and superego. So when you are defensive, you are wanting to save yourself from hurt or disorganization. So in order to protect your ego, there is denial. No, I didn't break it. No, I didn't do it. This is not my responsibility. I am not going to do it. You regress, so you go back. Rationalization. For example, a student who has not scored well or has failed in a particular exam will always try to blame the teacher or the university or the school or the college, but will never say that I didn't work hard, I was playing, I was not serious about my course. That is rationalization. So what are the effects of severe stress? Number one, stress can have a very great impact on your biological self, on the sympathetic nervous system. Either there's a fight or there's a flight. Fight means you fight the situation. Flight means you run away from the situation. Your responses can be of two types. When the stress levels are high, there's increase in the heart rate is likely. Blood pressure, raise in the blood pressure is likely. In your pulse rate, in your pupils dilating, the rise in the sugar levels, blood sugar levels, and the constriction of the skin. Stress can affect your immune system a lot. I think in today's COVID-19 times, we are being told a lot about our immune system. You know, you can boost your immune system like this, you can boost your immune system like that. This is what you can do for your immune system so that we don't get the coronavirus in our body. So affecting emotional states like grief, separation, divorce, examination, like you're grieving a death. Somebody is in the hospital with a very bad accident, so you're grieving that. Mother and child are separated. Divorce between husband and wife, a married couple. A very important IS examination or an IPS examination. These are emotional states which affect your immune system. Stress can have a very severe impact on your health, on your physical health. For example, so many people due to stress get high blood pressure, what we call essential hypertension. So many people develop a heart condition. So many people, and so many researchers have claimed that they get cancer. So many stroke, etc. So what are the psychological effects of stress? Number one, the personality decompensation. The personality kind of just breaks down. You as an individual just break down. You just don't know how to handle it. Your tension levels, your worry levels, they all go up. You become very, very sensitive. Somebody just has to touch you like this and you go like a bomb. You become very, very sensitive. You're easily irritated. You're easily angry. And you just burst out. So many people suffer when they are under stress. They suffer from gastric problems. They get acidity. They suffer from peptic ulcers. And so many stomach-related problems. They are burping and so on. Your efficiency is likely to come down when you are under stress. You become very rigid in your thoughts, cognitively. Sometimes the stress is so, you are physically and mentally so exhausted. You just don't have the energy to do anything. There was a time when you would come back from office, work there the whole day, maybe 10 hours, 12 hours, come back home with a huge smile, beautiful smile, and go out with the family again for dinner. And you're absolutely fine with it. But when you are under stress, you are exhausted, mentally and psychologically, physically. You are psychologically disorganized. You are unable to cope. Shall I do this? Shall I do that? This is okay, that is okay. You're very disorganized. You get delusions, hallucinations. In severe conditions, when stress levels are extremely high, people start hearing voices. People start seeing things which are not actually there. So delusions, hallucinations. In severe conditions, there's a complete breakup with reality. For example, in depression, there's a complete breakup with reality. There's only one thought, that I'm depressed, I'm sad, nobody loves me, I want to die, and I'm going to commit suicide. And the person might do it or might attempt it. The person doesn't think that after I've gone, what happens to my family? What happens to my children? What happens to my wife or my husband, my parents? What will they do without me? Sometimes we are very angry, we are violent, we are throwing things when you are under stress, which you would not do in a normal condition. And why stress? Why are we talking about stress? Because stress is very dangerous. As I told you, it could lead to stroke, it will lead to heart attack. And sometimes the first attack could be very fatal for you, and one could die. So what is the cost of stress? Very high cost of stress. 40 minutes. So about 89% of the population in India say that they are suffering from stress, compared to the global 86%. Nearly 75% of the respondents are not very comfortable talking to the medical professionals about their problems. The WHO estimates that India will suffer economic losses amounting to staggering $1.03 trillion due to mental health conditions between 2012 and 30. In India, mental health issues are even bigger taboo than they are in the other countries. 71% of the Indians still feel that mental issues are stigmatized and a matter of prejudice. So nobody wants to talk about it. 38% of the working women in India show signs of psychiatric morbidity, compared to 26% who are not working. Most people spend about 1/3 of their lives in their workplace, so amounting to about 90,000 hours over a lifetime. So if you're stressed in your workplace, you would have to find out some way to come out of it, because you're going to work for so many hours. While stress continues to be an issue for everyone, women report higher stress levels than men. I guess because they are caretakers, they are taking care of the family, they're the caregivers, they have to give birth to babies, and the responsibilities of the marriage and the family and to work are too many on the women. So 88% of the working women are stressed in comparison to 85% of the working men. 30% of the women, they claim unmanageable stress in comparison to 11% of the men. I like this word, the sandwich generation, 35 years to 49 years. They are a matter of great concern. Look at this slide. I won't talk about it, but just have a look. It's very interesting. Even this one. We as Indians spend far more time at work than the other countries in the world. So we talked about stress. I tried to explain the meaning of stress, how it is caused. How can I close my lecture without talking about the solution of the problem? Never even for a moment think that stress will not be there in your life. It is there every moment, every minute, every second in your life. You can't remove that, but you can reduce stress. There are so many methods by which you can reduce stress in your life and make yourself a happy person and have a good psychological well-being. Look at this image. I liked it, so I thought I must show it to you. It says everything about the stress reduction methods. So what can you do to reduce your stress? The first and foremost, identify the source of stress. From where is it coming? What is the reason for the stress? When does it happen? At what time does it happen? When I'm entering the office and I have to go and meet my boss, then? When I'm going home in the evening to my family, is it then? When I'm with my wife, is it then? What is it that is causing stress? Identify the source. Try to live a more balanced life. So that is your diet, your nutrition, your sleep, your exercise, your working hours. All this has to be balanced. Anger management, time management are two very, very important things. Very easy to be angry, to be throwing things, to be shouting at people in your workplace, at home. Maybe nobody will say anything to you. But you need to manage your anger, because more than other people, it is going to affect you, your body physically and mentally. Time management is a very, very important thing, even on a holiday. Even when you are having a Sunday, a holiday, you need to, even if it's vacation time, you need to have some kind of a time management. Otherwise, everything is going to be disorganized. What's wrong in accepting support from other people? Your family, your neighbors, your friends, your colleagues with whom you're working. What's wrong in asking for support? What's wrong in saying, please help me, I need your help? We have to find different methods of relieving our stress. Do you love music? Listen to it. You love to dance? Do it. You like to go out for a walk? Do it, because that will relieve you of your stress. I want to go and meet my friends and do halla gulla. I want to go and have a party. Go do it. Have a very organized and a simple life. Don't make it complicated and unnecessary. Nurture yourself. Love yourself. Nurture yourself. Take a break. Keep a diary wherein you note down the important events of your life. And friends, my colleagues, those who are listening to this lecture, if nothing helps and you really feel that nothing is helping me, all guidance, all advice, everything that I have done is not okay, it's time that you need professional help of a clinical psychologist. It is not stigma. It's not wrong. Please go and visit a clinical psychologist. Environmental methods to reduce stress. We try to reduce the importance of the event. Every event in our life is important, but some are extremely important. So if you reduce the importance of the event, the stress levels are going to be lower. Uncertainties are there in all our lives, but we try to reduce them as much as we can. As I've told you before, if you like to listen to music, it relaxes you. There are a lot of, on the YouTube, there are lots of relaxation techniques which are now there and you can use them. Progressive muscular relaxation. This is a typical method which is used in psychology, where your muscles are gradually and progressively relaxed. And because of that, the entire body is relaxed. Breathing exercises, so many people today are talking about breathing exercises. That helps you a lot in relaxing you. Psychological techniques, imagery relaxation. I must talk to you about this. So you imagine a time where you were very, very happy. It could be your childhood or any event in your life. And you start imagining it when you were really delighted, happy. It will relax. This is, of course, handled with a skill by a skilled person. And thought awareness, rational thinking, positive thinking. Then it's very difficult to cope with stress. Cognitive therapy helps a lot. And today we have the new concept of mindfulness. To be mindful, to be conscious of what you are doing. Psychophysiological techniques, for example, self-hypnosis, auto-suggestion. No, I'm not going to be stressed. I'm not going to be stressed. Why should I be stressed? As humans, we all face the same situations. Do not think that the situation that you are facing, I'm not facing. The situation that I'm facing, you are not facing. We are all facing the same situations because we're all humans. Meditation helps a lot. So many yogic asanas help a lot. We're not talking in detail about them because that's not the real subject today. Yoga in itself, meditation in itself, mindfulness in itself, cognitive therapy, cognitive behavior therapy in itself are huge issues. Laughter. Can you remember when you really laughed? Ha, 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 ha. From the bottom. If you like to dance, dance. You like to draw, paint, then do it. Dieting, that's food, the nutrition that you're eating. Your diet is a very important source. There are a lot of things which irritate us, irritate our stomach. And a proper nutritious diet throughout the day is very, very important. Proper amount of vitamins, proper amount of zinc, proper amount of potassium, sugar, glucose, fructose, etc. in the balanced diet is very, very important. Exercise is a must and I'm all for it. I must go for a walk every morning. Otherwise, I feel that my day is not okay. Walk gives me a lot of relief. Some people go jogging, some people go to the gym, but some people go for a swim, some go for cycling. But some source of exercise is very important. So the effects of stress and its cause are enormous. Physiological, psychological, psychophysical techniques have shown very appreciable results. It is hoped that we control stress and that will be beneficial to us. I like this A to Z of stress management very much, and that's why I have brought this for you. A is always take out time for yourself. We're always busy with other people, but we do not give much time to our own self. Be aware of your own stress meter, how much you can take. Concentrate on controlling your own situation. Daily exercise, eating, we just talk about eating lots of fresh fruits, vegetables, etc. Forgiving behavior. If you forgive, your stress levels are definitely going to be lower. It makes you more tolerant and more mindful. Gain perceptive on things of how important is the issue. In India, we are not, the hugging kind, the kissing kind, the laughing kind. What will people say if I hug somebody in public? Your father, your mother, your husband, your child? How does it matter? But hugging makes, showing, you're exhibiting your affection. It makes a lot of difference to your stress levels. The touch. Identify your stressors. Judge your own performance realistically. A lot of people come and appreciate you and say, wow. So you feel, okay, wow, I'm great. But judge it realistically and critically. Have always a positive approach. Your outlook will change. Limit alcohol, drugs, if you're smoking or if you're drinking. It could be even tea and coffee. A lot of people have 16 cups of coffee, 16 cups of tea. All that caffeine and nicotine could be very bad for your physical health as well as mental health, because finally it is addiction. Managing your money, spendthrift, is not okay in today's times. No is a word which you must learn to say without any guilt. No, I'm sorry, I can't do it right now. I'll do it tomorrow for you. No, I'm sorry, I can't help you because this is something I don't know to do. Outdoor activities, sometimes just for yourself, walking alone, going with friends, family, relaxing, playing your favorite music, quit smoking because it stresses your body. Relationships are building them, nurturing them, enjoying with them is a very, very important thing. Sleep well. Remember the times when there's a festival and you're up half the night or all night and you do not have enough sleep, then if you have not slept well, obviously it's going to affect you. Treat yourself with a massive dinner. Treating yourself is also very relaxing. Understanding things from another perspective, another person. We always try to force our viewpoint, if you have noticed, on other people. You listen to me, you listen to me. Parents do it, teachers do it. Verify information before you explode. Somebody came and told you, is it true? You verify. Worry less. Things will happen. You always feel that if I don't do it, it will not happen. No, it will happen. So worry less. Express yourself. Have a goal in your life. Plan everything whichever way it is possible. Last but not the least, zest for life. Zest for life. Under every circumstances, whether COVID-19, whether it's a heart attack, whether you have lost all the money in the business, you have no job right now, it will happen in the future. The zest for life. I will live. In psychoanalysis, Dr. Sigmund Freud has talked about the life instinct. So under every circumstances, I will survive. I will live. Each day is a gift. Smile and be thankful that you are part of the bigger picture. I like this. I thought I'd share with you. It's talking about freedom. It's talking about smile. It's talking about laughter. It's talking about togetherness. Relax. The lecture is over. I hope I have done my job, and I hope I could give you something better today. Thank you so much. Thank you for patiently listening.